Good afternoon. My group Focus on the Future is going to discuss ADHD in children. My name is Ansu George, and this project is worked on with Ashley Vallis and Kyla Whitfield. History of ADHD became a topic during the 20th century. It was earlier referred as the hyperkinetic reaction of childhood, before it was later recognized as ADHD. The history of our topic became really well known in 1960s. So now during the 1930s, there was a medication named benzodrine that became approved through the FDA to help treat ADHD and other mental health illnesses. It wasn't until 1960s when the American Psychiatry Association, or known as APA, formally recognized ADHD in their DSM-2, or known as the Manual of Mental Health Disorders. In 1987, the diagnosis was later evolved into attention deficit disorder with or without hyperactivity, or known as ADD or ADHD. This acknowledges the intention that can occur with or without hyperactivity. Now, later on, Dr. Charles Bradley, who happened to stumble across some unexpected side effects of this medication we mentioned earlier, benzodrine, happened to be prescribing it to his young patients and helped their behaviors and performances in school improve. And it wasn't until later, when Bradley had ignored his foundings, that other doctors and researchers began to notice the patterns and benefits of Bradley's undiscovered discoveries.
The purpose of the study is to examine effective school-based intervention strategies for children with ADHD. These include behavioral interventions, academic modifications, and homeschool communication programs. The study also emphasizes the importance of collaboration among school professionals, such as teachers and school psychologists, to support student success. The study focus: this research explores how a combination of strategies, when applied consistently, improves both academic performance and classroom behavior. The role of a teacher-psychologist collaboration in designing and delivering interventions, and a review of current research on effective practices for supporting students with ADHD. Family impact and parenting styles in families of children with ADHD. This project explores the impact of attention deficit hyperactivity disorder on family dynamics and parenting styles in households with children diagnosed with ADHD. It also examines how these children experience social interactions and the potential challenges they face in building friendships, drawing on observations and insights from those closest to them. The study examines the ways ADHD affects family relationships and parenting styles of fathers and mothers. It shows that the parenting styles are more associated with the effects of the child's behavior in family and marital life than with the child's disorder itself. Researchers also found that families of children with ADHD experience greater family stress and dysfunction. These challenges were associated with more authoritarian and less supporting parenting styles. In addition, parents of children with ADHD were more likely to report higher levels of emotional stress and greater difficulty in managing behavioral problems. The study will focus on the following research questions. What role do parents and teachers play in supporting social development in children with ADHD? And what challenges do they face when trying to build and maintain friendships, according to parents and teachers?
The methodology brainstorm. The methodology type that we ended up using is both quantitative and qualitative method. It's called mixed methods. This allows us to gather both measurable data as well as personal experiences. The data collection method that we ended up choosing was surveys and case studies for quantifiable research, interviews and observations for deeper, more personal insights. The target samples that we chose to focus on were parents, teachers, and siblings of children with ADHD. They could either be older or younger siblings. Why did we choose this method? ADHD and other social skills are complex. We don't want to just rely on the numbers because not all people have the same sort of experience when it comes to ADHD. Mixed methods gives us both broad patterns and individual stories. It also helps us understand not just what is happening, but why it's happening. Future directions and implications. Future research ideas. We think longitudinal studies tracking kids with ADHD over time can be very useful. Compare the different school settings that children are in, public school, private school, as well as homeschool. Study cultural and regional differences in social skills development and ADHD support. For example, everyone in our group comes from a different background, so not all of us have experienced ADHD the same way. Different methods: use direct observation in classrooms or peer groups. Conduct interviews with children, not just adults, for their own perspective. Implement video analysis with consent, of course, to study behavioral patterns. Why does it matter? ADHD affects many children worldwide. Understanding social developments help shape better interventions. This can lead to improved school support as well as stronger parent education, and can have a can lessen the stigma of ADHD. This is our references. Thank you.